Hello, everyone. I'm Aditi Subramaniam. Welcome to today's discussion on the impact of the COVID-19 pandemic on families, kids, and college students. This is the third event in a series on COVID-19 science and coverage organized by the Council for the Advancement of Science Writing and the National Association of Science Writers. This panel has been organized in association with the University of Colorado's Boulder and Anschutz medical campuses and St. Jude's Children's Research Hospital. We are now several months into the pandemic that has been raging around the world, and there's no clear end in sight. While everyone's lives have been affected in some way by the pandemic, children and teenagers have been hit especially hard. I'm joined today by Dr. June Gruber, Dr. Stephen Berkowitz, and Dr. Kendra Parris, whose combined experience and expertise in this area promise to make this discussion an enlightening one. Dr. June Gruber is an associate professor of psychology and neuroscience at the University of Colorado Boulder and the director of the Positive Emotion and Psychopathology Laboratory. She was previously on the faculty at Yale University and received her PhD from UC Berkeley. She's also involved with science outreach for students and the broader public, with a focus now on the mental health crisis sparked by the pandemic. Dr. Stephen Berkowitz is a professor in psychiatry at the University of Colorado Anschutz Medical Campus. He has previously been on the faculty at Yale University and the University of Pennsylvania and has written, lectured, and taught extensively on childhood trauma and its treatment. He runs a statewide initiative with respect to the COVID-19 pandemic to provide mental health resources to healthcare workers at this time. Dr. Kendra Parris is a psychologist at St. Jude's Children's Research Hospital in Memphis, Tennessee. She received her bachelor's degree from Johns Hopkins University and her master's and PhD degrees from Florida State University. Her research interests include the psychosocial functioning of children and adolescents undergoing bone marrow transplantation and the psychological adjustment of children and teenagers to chronic medical conditions. I know this is an extremely busy time, so thank you to the three of you for taking the time today to share with us your expertise. I'm really looking forward to today's session. I know that many parents have a number of questions at this difficult time, and as the parent to a toddler myself, I have quite a few questions of my own. We will have time towards the end of the session for audience questions, so please feel free to use the Q&A section on Zoom to send in any questions that you might have. I'd like to start off today's discussion with each of our experts speaking a little bit about the effects that they anticipate the pandemic to have on the mental health of children and teens, or about the effects that they're already seeing in their professional lives. Dr. Parris, would you like to start?
Sure, thank you for that very kind introduction. So we're living in an unprecedented time where children are facing not only the pandemic, but issues related to systemic racism. And we know from other recessions in our country and other illnesses that have required isolation in our country in the past, that we have seen increases in children's mental health problems. And unfortunately, children who come from marginalized or underserved populations are at even higher risk. And they are the ones that are also being disproportionately impacted by both the pandemic and the systemic racism that is happening in our country. So I have great concern about our children, and I think we need to ensure that mental health services are not only widely available, but are targeting these most vulnerable children.
Thank you, Dr. Parris. Dr. Berkowitz?
Well, I think what Dr. Parris said is really important, that much like the rest of our nation, there's almost a dichotomy in how children are doing based on whether they're from marginalized communities, financially stressed, and so forth, versus, better off, more access to technology and so forth. I think it's a real issue that needs to be addressed. I think that's a major differential in what we're seeing. I think the other thing that we need to, and I hope we'll be talking about, is children, even more so than adults, live in nested systems. And so much of their mental health is reliant on the family system, the school system, other such systems. And that, as well as their functioning, may be as well as the child or youth is functioning.
Yeah, I'm sure we'll get to that at some point during the discussion today. I hope we do. Thank you, Dr. Berkowitz. Dr. Gruber?
Hi. Echoing what everyone else says, we know that this pandemic has really left no one spared across the lifespan, but there are really unique risks for youth. As a professor on a college campus here in the US, we're also seeing a lot of effects on our young and emerging adults who are currently college students. They are facing a combination of stressors that are financial, that are social, and that are academic. Many of them have missed certain rites of passage coming into college, missing their high school graduations, missing key developmental milestones. And at this time, as they're now sort of navigating their autonomy and identity on college campuses, they may be facing tenuous uncertainty about their future, employment, and opportunities beyond college. Increased academic stressors as many students are trying to navigate the online college campus, and really curtailing normative social interactions that are key for this age, but that are right now limited due to physical distancing requirements. So we're seeing an already fragile mental health ecosystem among older adolescents and young adults in college campuses. Really at risk for even more escalated challenges with substance use, depression, and anxiety.
Right. Yeah, I think the uncertainty around this pandemic has really made things so much more challenging for everybody. Thank you all for those insights. My daughter is turning 3 next month, and she seems blissfully unaware of anything pandemic related right now. But I know that while it may seem like younger children don't really know what's going on, they can definitely pick up on parental stress or the anxiety of the people around them. Dr. Parris, if I may ask you this next question. How can parents communicate with and respond to children of different ages and developmental levels about the pandemic?
Sure, I think that's a really important question. So when we're thinking about our youngest children, we know that they are not cognitively advanced enough to understand aspects of the pandemic in the way that older teenagers and adults do. So we certainly, when we communicate with younger children, we want to clear up any misconceptions that they may have. We want to speak in very simple and basic terms with young children, but we want to be honest because we know that honest communication can help decrease anxiety and clear up those misconceptions. We also know that for children, play is one of the natural languages of children. So I would really encourage parents to utilize play as a way to communicate with their children right now. We know that play has significant advantages in terms of a child's development. It also allows for communication and emotional expression. With older children and with teens, again, we want to be honest and open with them. We know that teens may not be as willing to communicate about their experiences with their parents, but we want to ensure that they have an open space should they desire that communication. I think with teens, we also need to, again, clear up any misconceptions they may have. Teens use social media a lot, and there is a lot of misinformation out there. And we have to remember that teens are going through a developmental stage where they think that they are invincible. They think that risks don't apply to them. And so they may become jealous or angry if their friends are allowed to do things that they're not allowed to do. And we need to open up the lines of communication with them about that.
Thank you, Dr. Parris. As a parent, much of what you said resonated with me. In many ways, this pandemic is a really unique mental health challenge. Dr. Berkowitz, if I may turn to you now, you were involved in the development of guidelines on how parents and children could deal with the aftermath of the 9/11 attacks. In what way has this pandemic been a unique challenge to the experts?
Wow. Yeah, the relationship between a pandemic and a natural or man-made disaster is pretty limited. And I think We have to recognize that. So first, we have this pandemic, right? That is the backdrop. And then it's sort of this erosive, constant stressor that's always there. And so it's a very different context than something that happens once and then has influence, down the road. The other piece that was mentioned, I think is very important for our children, is it's not just the pandemic, right? And this is not unusual, by the way, in pandemic situations, but we have social justice issues of race and identity. We have multiple natural disasters, the wildfires, the hurricanes. We have, some of the most incredible political and social acrimony that we've had in a long time. And then I think importantly for older kids, we also have the issue of climate change. For everybody, but I think all of this weighs very heavily, right? And it's not, I think it's important that we not think and talk to our children about any one issue, that these are all there. And one of the things, particularly for teens that, that Dr. Parris mentioned, the reticence to discuss, one of the best ways in is to say, what are you and your friends talking about? What do they think about this? You often get to hear what their friends have to say, which is really what they're having to say. And so I think there's really differences in development and how you approach it. Dr. Parris mentioned the younger children. The other thing that younger children really want to know is that you're taking care of them, that they don't have to worry. So there's it's really important to think about this developmentally, to watching the news together and discussing it with older kids, school-age kids, to really think about who they are, what they need, and to operate closely with them. So guidelines are great, but I think this is again unprecedented, and we have to cover such a large range of issues. And again, not just thinking that the pandemic is the root cause of everything.
Thank you, Dr. Berkowitz. It is essential, like you mentioned, for parents to realize that there are so many issues intertwined in this pandemic that really make it a challenge. That was really eye-opening. Changing tracks a little bit here. So while it's essential, like you'd mentioned, for families to try and maintain a positive outlook through all the bad news out there, there can be pitfalls to too much optimism as well. Dr. Gruber, much of your research pertains to how a positive attitude, when taken to the extreme, can have negative consequences for mental health and can sometimes lead to excessive risk-taking behavior as well. Is there something you would like to talk about with respect to this, with regards to the pandemic?
Absolutely. So we know that our emotions are important sources of information about the world. Positive emotions signal opportunities in the environment and signal opportunities to connect, and that there's really optimistic, good things happening. But that's not the situation every time, nor certainly is it common situations that we're encountering now during the pandemic. So our research has showed that when people are experiencing positive emotions, maybe in contexts that are not necessarily positive, that they may actually be improperly attuned to the world around them. So we suggest that rather than feeling pressure to feel happy and trying to smile in the face of stress, that what we call emotional diversity, sort of experiencing a broad range of emotions that can be positive emotions, but it can also be negative emotions, is sometimes a very adaptive response. We find certainly that individuals who have more diverse emotions, that are more in tune with the changing world around them, actually fare better when we look kind of over time at both their mental and physical health. This suggests that it's okay to feel stressed, it's okay to feel anxious, that's actually our emotions telling us about what's happening in the world around us. And that when we do have these negative emotions, even if they are difficult to experience, that we can tell ourselves that it's okay, that this is normal, and that it's something that we can accept. I think the issue is when people try to push away or suppress negative emotions and replace them with positive emotions, we find that that can actually lead people to have more poor mental health outcomes. We've done some work, for example, among young college students who feel pressure to feel happy and spend exorbitant amounts of effort pursuing happiness in the face of a global pandemic, perhaps rather than sort of grappling and coping with the stressors at hand, that they are actually at greater risk for depression, anxiety, and some of the more severe mental health outcomes that we study in my lab, including bipolar disorder. So just to remember that emotions are not negative things. They are our mind's way and our body's way of telling us what's happening in the world around us. And in times of stress and in times of threat, fear, anxiety, and even frustration at the social injustices are not only perfectly normal and appropriate, but they might actually be the more adaptive responses to the world around us.
Yeah, thank you so much for that, Dr. Gruber. That was like a really unique perspective, and I think too many people don't think on these terms with respect to negative emotions. So I'd like to move now to how parents in their changing roles during this pandemic and how that might affect them and their families. So many parents are having to juggle multiple roles now, including full-time childcare along with their careers. Dr. Parris, I was wondering if I could address this to you. How are these roles impacting parents?
Sure. So this is a really unique time where parents are experiencing not only changes in their roles, but often multiple roles that are new to them. So it's not uncommon right now for some parents to not only still be full-time workers, but to also be full-time parents and full-time teachers. And these are all essential and critical roles that we can't neglect. So I think there's more stress on parents right now because of the need to fill these multiple roles. And obviously there's increased time burden on parents as well to manage the many different things that they are managing right now.
Thank you, Dr. Parris. Yes, I think many parents are having to like juggle all these responsibilities, and that can kind of add to their stress as well. So I'd like us to speak a little bit now about how, as with any public health disaster, not all families are affected in an equal manner. Dr. Berkowitz, if I may address this to you. So underrepresented minority and low-income families have been disproportionately affected by the pandemic. This is actually a question from Julia Milzer, one of the organizers of today's session. And she asks what the experts think about what the long-term effects would be for these communities and what we can do to support their mental health. Dr. Berkowitz, would you like to take this one?
The long-term effects are really an interesting question to me. And I think one of the things that, in my work, what we are seeing from a lot of families in the marginalized communities is food insecurity, really worrying about obtaining food, going to food banks, struggling with technology. A lot of people have metered internet services, for instance, and how do they do that if they need to do online learning? The other piece that I think needs to be mentioned is that in many of these communities, there's been a tremendous uptick in violence. And kids are being exposed to community violence in a way that, hasn't happened for a very long time in this country. I'm really concerned about these communities going forward. I think, the inordinate stress that they've experienced has all sorts of ramifications on children's optimal development, learning, and I think we see these communities as at really much higher risk for the long-term impact. There's research, constant research in any disaster situation. Who fares worse? It's middle-aged women who are taking care of everybody, and it's marginalized and poor communities and countries over the short term and the long term. Katrina is a great example. we are still dealing with the effects of Katrina and intervening, but it's really around the marginalized minority communities that we've been doing that. So I have grave concerns. In terms of the mental health for these communities, this goes back to a political agenda, but we should be ensuring that every family can live and function. So these governmental supports and subsidies are crucial. And the more marginalized, the less your income, the more important they are. And those stresses, if they're financial, they're real. So that's where the mental health will be affected, both the short and long term. So at least let's try to remove some of the most obvious stress. And that is, income inequality.
Yeah, thank you, Dr. Berkowitz. Yeah, I think we can just hope that governments and society at large kind of takes into account these really inherent social inequalities while looking at the effects of the pandemic. We did touch upon briefly about virtual interactions and some of the pitfalls of social isolation. These can be especially hard on children and teenagers who are used to going to school and interacting with their peers. Would you like to speak a little bit more about some of the effects of the move to virtual interactions on children of different ages and developmental stages? Dr. Gruber?
Sure, I'd be happy to talk about this. This is very challenging for us because we know that especially all human beings, but especially youth, a lot of how we learn about the social world is through interacting with people and dynamically reading their emotion expressions. And a key part of what has changed in our virtual environments is our ability to make eye contact and to accurately read and gauge the emotions of others. So one of the key pieces of information that we use to navigate our social world that fosters and supports emotional development has changed, right? We're not able to kind of dynamically second by second really interact with people in the way we used to, whether because of delays over computers or whether because we have masks covering a portion of our face and we can't sort of hear some of the vocal signals or see the full range of facial expressions. And so this is a challenge on the kinds of interactions we're having. We also know in many ways that interacting socially in person has a lot of rich opportunities and experiences that can't be replaced virtually. At the same time, however, when I think of youth and families, we say that even though social interaction is constrained, it's not the same. That doesn't mean that there are no opportunities to reap some of the benefits of social interactions, even if virtually. That we can still engage in conversations, we can still engage and interact and sort of tell stories, teach our children about emotions through the kind of process of storytelling, and we can still have important and difficult conversations. So although it's not ideal, and although there are some limitations on the kinds of information emotionally we can gain from interactions, it's not a zero-sum game. It's not, you have it or you don't, but we're somewhere in between, and we need to sort of do the best and make the most we can of the sort of virtual environment we're in for the time being.
Yeah, absolutely. I think like this time in history does have some unique advantages as well. Like I can't imagine the pandemic having happened a few decades earlier. And I mean, so virtual interactions are really like a double-edged sword, I think. So I'd love to hear our experts speak a little more now on how not all children react to different situations in the same manner. In fact, what stresses children out can also vary immensely across individuals. So what predisposing factors or behavioral traits can affect how well or badly a child responds to the pandemic? Dr. Berkowitz, would you like to take this one?
So it's a really interesting question, and clinically, it's a very interesting question because we, have seen in some of our patients who actually are thriving with the decreased social interaction, those are the kids who found being in school, dealing with other kids, really, really difficult. And so, you know, and they're not necessarily kids that are on the autism spectrum, but they're kids who are, you know, more quiet, withdrawn. And so that's been fascinating to see this group of kids who are thriving now without it. So there's some real, you know, genetic constitutional variance in that regard. With that said, most of the children and adolescents who are not yet attending school or some hybrid that they find it very stressful. They find it very hard to manage. They, you know, like us, you know, everything takes a little bit longer, needs more intentionality. Well, that's not how kids operate in school, right? They really need that social interaction and you know, working together and that kind of thing. So we see a lot of kids who are just sort of checking out during the school day, or struggling to manage it. Or, you know, the other piece is the you know, particularly the younger school age kids, you know, how can we expect them to effectively learn online? And the burden on the parents is so tremendous that there's a lot of anxiety and tension, irritability, which only furthers the cycle, right, of not being able to engage in classes the way they would like. So, you know, those happy-go-lucky extroverted kids a year ago are the ones that I find having the most difficult time right now.
Mm-hmm. Yeah. Thank you, Dr. Berkowitz. Adolescent brains have been shown to be especially vulnerable to stress. What effects do you expect the pandemic to have specifically on adolescent brains and development? Dr. Gruber, would you like to address this?
I think that's a great question when we think about brain development and emotion processes. We do know that, you know, when we think of adolescence and into young adulthood, it's a period of duality, a period of both an opportunity for growth, of cognitive control, of, you know, executive functioning coming online. At the same time, we know that it's a period of heightened sensitivity to rewards, kind of more intense emotional responses. And so if we think about this kind of dual systems that's emerging in adolescence, where we're having different emotions, new emotions, intense emotions, perhaps as we're navigating new relationships for the first time, maybe intimate relationships, while our kind of prefrontal cognitive control systems are still kind of coming into maturity, it's already a very unique period of development and of sort of balancing those two systems. If we now superimpose upon it the pandemic, of navigating social interactions like nothing before, of having new academic stressors, new uncertainty, we don't know yet how this is going to affect brain development. We have some of the leading scientists studying this right now, developmental neuroscientists like Erica Forbes at Pittsburgh and others. So there's some data to be awaited. I think we may have concern about the challenges that this is going to pose for adolescents, but at the same time, I have faith that we do know that this is also a time in development of great resilience as well. And so although there may be duress under adolescence, we may see in the moment adolescents as well as other youth and adults exhibiting poor emotion control in the moment. I have faith that these will be opportunities for growth and resilience as well in the long run.
Yeah, thank you, Dr. Gruber. Another very direct consequence of the pandemic is that there are families dealing with sickness or death in the family. Dr. Parris, how would this affect kids and teens, and how can families actually help them deal with this stress?
Sure. So certainly if a child loses a loved one because of the virus, that is certainly going to increase the child's anxiety about their own well-being. And again, I think we need to think about that when anybody loses a loved one, they go through a time of grief. So grief is a normal process for coping with the loss of a loved one. And grief is characterized by very strong emotional reactions, strong physical reactions, even spiritual distress. So seeing those types of reactions from a child may be alarming, but they are normal parts of a grief process. And when we grieve the loss of a loved one, we're really trying to come to terms with that loss and find ways to adapt to that loss. But obviously there is concern that if a child deals with the loss of a loved one or illness of a family member, that may put them at higher risk for developing a mental health problem. So we want to monitor those children closely, and we want to offer supports to them, whether that's supports from family or supports from professionals. I think we also would want to try to encourage these children to engage in health behaviors that we know can promote their coping. So trying to encourage these children to obtain adequate sleep and to eat healthy and to exercise and to do those critical behaviors that we know can promote their coping through the difficult times.
Mm-hmm. Yeah. Thank you, Dr. Parris. People are tending. Yeah, sure.
I just want to add that childhood grief is really not recognized in the way that it should be, and that it is powerful and can have long-term detrimental effects when it's not managed well. And so if you look at most child clinics, about 1/3 of the kids will have a loss of a first-degree relative. And that often goes unrecognized and unexplored. And so I'm actually hoping that because of the pandemic, we will pay more attention to those experiences in children. You should all know, many of you probably do, that the DSM is about to add prolonged grief disorder as a diagnosis. And I'm no big fan of the DSM, but it does allow us to now, recognize something more directly, and I think that's very, very important.
Yeah, it is essential that the medical community as a whole and parents as well kind of recognize that this can be extremely important in the development of in the mental health development of a child. Dr. Berkowitz, people are tending to avoid hospitals right now for like non-emergency situations, and is that affecting how they're approaching mental health care as well? Number of children used to get mental health care in schools, so with schools now closed.
Yeah, that is a great concern that we have. Is not about the kids who we know about, but the kids that we're missing. Who are struggling, and particularly those kids who are served in school-based clinics, so are at a loss. Now we've been able to take the school-based clinics that in our system and to provide virtual care for at least older kids who have access, and I think we need to be able to do that. We need to make sure we can reach out, provide virtual intervention. Younger children, need to be seen in person if possible, or at least really strong virtual work with their parents. So I think it is. I'm more concerned about the kids we don't know about, who haven't come forward because they don't know how to access therapy. The parents don't know how to access it. Interestingly enough, initially we saw a decrease in emergency room visits for psychiatric care. That's now kind of come back to what it was a year ago at this time. And there are no inpatient beds available. And so it's pretty clear to me that we're only really addressing the tip of the iceberg at the moment. And so it is a real concern that we're not identifying. And that's what school is so good for, right? School is so good for teachers and others, recognizing kids who are struggling, and they, that's just not happening.
Mm-hmm. Yeah. Thank you, Dr. Berkowitz. All this can cause so much anxiety in parents and families. Dr. Gruber, how can parents actually deal with all the information and misinformation out there and weed out the good from the bad and kind of take care of their own health before turning to that of their kids?
I mean, I think that's the ultimate question is what can parents do during these times? Times as well, as you're saying, they're overwhelmed with information and where they have limited resources, whether that's finite time, right, with school closures and childcare closures, as well as sort of finite energy, feeling tired, feeling burned out. So I think that the best available resources are to go to leading scientists, to watch panels like the ones that you've organized, to hear what some of the experts who have spent their careers studying family systems, children, mental health, and health of adolescents and young adults, what they might have to say. There's so much out there, so much misinformation, but I think as much as we can help provide parents with resources and science-based evidence and science-based suggestions, that's the best way that we can help sort of narrow the amount of sheer volume of information that parents are getting, and also help steer them towards what's most accurate, which sometimes can be easier said than done in this age of massive amounts of information that are shared from all kinds of resources.
Sure. Thank you so much to all of you for those illuminating insights. I'd like to turn now to some audience questions. Asks, I have a 21-year-old daughter getting ready to graduate next year from college. I have already watched her being overly stressed as a senior in college, already dealing with chronic medical conditions. Throughout the pandemic, her stressors have led her to put on an extra 50 pounds due to insomnia and overeating, which has put her health at even more risk. Any thoughts on how I can help her as a mom? She's also African American, which compounds the effects of the pandemic.
Some of the resources that we've been recommending to college students it's kind of a multi-pronged approach, and there's really no one size fits all. And especially, there's issues of intersectionality, right? Also coming from underrepresented backgrounds. Some of the multi-pronged approaches that we've suggested to college students and to their faculty on campus as well include: one, we need to destigmatize mental health and illness on campus. We need to make efforts towards normalizing conversations around mental health so that students feel less stigmatized and are more likely to seek treatment and seek support. Two, we need to empower young adults and older adolescents with science-based information, teaching them about the science of mental health and teaching them about also the science of happiness. I suggest to my students, there's a lot of wonderful resources out there, including the Happiness Lab podcast. This is about evidence-based practices that everyone can use in their daily life to increase their wellness and happiness on a day-to-day basis. I also suggest that we, as college campuses, make it a routine part of our education for college students that we teach them about mental health and mental illness, that this isn't just coursework that students in psychology take. So on my campus, we've been developing first-year courses for freshmen that we intend to roll out across the years that are one-unit courses that teach students about what is mental health and illness, what are empirically supported treatments, and what are sort of practices that they can implement in their daily lives. I think finally, one of the things that I think is really important for young adults like this is to feel that they are receiving kindness and empathy, that what her daughter is experiencing, a majority of college students are also encountering, with whether it's mental health, the intersection with racism, or the intersection with physical health conditions as well.
I'd like to add, and you said this before, Dr. Gruber, nobody is doing as well as they used to. And one of the things that gets in the way of, and I think of actually accessing mental health services when needed, like I think this young woman does, is the expectation that you're supposed to be better. And that can be as stressful as anything else, the expectations that you have that you should be functioning better, doing better. We need to recognize that, we're not, and that's the way it is. And I think that can go a long way and should be a message on campuses, that it's okay not to be okay.
Yeah.
I agree with that. And I think we need to, again, recognize that this is a very challenging time for everyone, and we need to give ourselves grace and give ourselves credit for what we are doing right now. The other thing that I want to add on for this particular scenario is that there are some really great self-help resources out there for young adults. Again, we want to make sure that they're evidence-based, but there are some great apps out there and other sort of self-help tools that are available.
Thank you to all three of you for mentioning these concrete resources that parents can go and look up later. Older teens and college students are not always keen to share their thoughts and feelings openly with their parents. Are there any tips on how to check in with teens, young adults about how they're doing in a way that doesn't send them running?
Yeah, well, I mentioned this before. I have found one of the best ways is to ask them about their peer group and what they're talking about, what they're thinking. And, hey, Johnny, what did you think about what happened downtown last night? What were your friends saying? And that engages them and it doesn't put them on the spot, and you'll hear their thoughts either through their friends or they'll respond to what their friends are saying. But I think, in my experience, that's been the most effective way to talk to youth of this age about some really difficult, complicated issues.
Yeah, I hope teenagers are not watching this because they're gonna get into what their parents are doing. But somebody asks, for parents of elementary age kids who are finding Zoom schooling to be very challenging, how do you recommend thinking about when to consider an unschooling or a homeschooling option?
And I see June has a school-age child, so maybe you should answer this. But I have many colleagues who have agreed that this is a pandemic year. And that's what we're going to focus on, and doing the best we can together to make it through together intact and well. And if their kids fall behind a little bit academically, we'll figure out a way to catch up. I think that's a reasonable decision in some families, depending on their situation. So I don't think there's a one-size-fits-all answer to this, but I think each family needs to think about it and to address it as best as possible. But the sanity of your child and of your family's functioning needs to be primary. Academics won't matter if it's not. So those would be my thoughts.
Sure.
I agree. I think that is a very individual decision for each family. And I agree that you have to balance a child's mental health needs with their academic needs. We certainly know that the pandemic is disrupting learning and it's disrupting academic achievement. And so I do have concerns if children just stop going to school, what impact that will have, both academically and socially. But again, I do think it's a balance of a child's individual needs and a decision that a family has to make.
And just adding to the comments that were said, and as Dr. Berkowitz pointed out, we're living some of the reality right now at home with two small children, a 6 and 3-year-old. And I think, both from first person perspective, but also thinking about the literature and what's already been said is what matters most is their social emotional health right now. I think we have to put that first and foremost. And then once we feel that's being addressed, we can see what space and time is left to kind of consider the more kind of academic aspect of things. Because certainly in the long run, whether, their mental health is supported and whether they have a, sense of stability in the midst of uncertainty, that's going to carry them far longer than, whether or not they met the academic milestone of, in our case, sort of learning to count to 100 in, in kindergarten this particular year.
Thank you. I think parents are having to like adjust their own expectations of various things at this point. There's another question here. They ask, I've been surprised during the pandemic that my 16-year-old, who's normally a social person, does not seem to be having a very hard time with the extreme isolation she's experienced. She actually seems pretty content, and although she claims she misses her friends, she doesn't take any steps to kind of see them in an outdoor or distanced way. I know it sounds strange, but this worries me a bit. Should it?
I think we're seeing a great degree of variability in how people are responding to the pandemic. For some adolescents, crowds and in-person social interaction was overwhelming, and this is offering a little bit of a reprieve. For other adolescents who may have really craved and thrived on a lot of in-person contact, that's particularly stressful. I think what we have to pay attention to is the variability in how adolescents are responding, and that there is no one normative or right response. And there's going to be different pathways of responding to this stressor. And it's going to impact different adolescents at different times in different ways. So I think just acknowledging that for some adolescents, certain parts may be harder and certain parts may be easier. And another child, even in the same home, may have a very different pattern of responding. That's part of the complexity we're grappling with, that there is not sort of one uniform pattern of how youth and adolescents are coping.
Yeah, I think that's, absolutely right. And the, the variability is enormous. And, I think there's a question behind her question, I believe, if I'm, which is, well, this is not how my daughter normally is. Should I be worried? And I would say, no, that's not sufficient. But if you're seeing other signs, withdrawal from the family, more irritability, less, less interaction at home, sleep issues, anything like that, then it may be the sign that her change in her outlook and behavior are more about depressive affect. So I just would keep that in mind. It's not, on the surface, great variability, but there are certain signs to be concerned about.
I agree with Dr. Berkowitz, and I'll just highlight, I may have mentioned this before, that we have to remember that teens may not be as open about their experiences and their emotions. So watching for those types of changes is really important for parents to be doing right now.
Yeah, thank you, Dr. Parris. I think we have time for like one more question before we move on to the experts' concluding remarks. I thought it was super interesting to hear Dr. Berkowitz say that middle-aged women, caretakers, and marginalized families experience the most short-term and long-term damage from crises like this. I'm curious as to what are the things we should be doing as a society or as individuals to mitigate these stresses on caretakers. Dr. Berkowitz?
I was trying not to answer. Look, it goes back to what I was saying before. We really need a sufficient safety net, and that the economic and other stressors are easily directly solved, and we need to do that. Because that's how we can then figure out who needs the kind of support and interventions that we have been talking about. Otherwise, we know that we're just continually stressing people beyond their capacity to manage. And so, again, we need to really expand our support, both psychosocially as well as economically, to these families that are at the highest risk. And that's a political question, but it's also science. The data is really clear that that these are the families, these are the kids that suffer the most.
Thank you. Thank you, Dr. Berkowitz. Okay, I think we're kind of close to the end of the session now. I'd like to turn it over to our experts one more time for their concluding remarks. If you could please take a few minutes each to speak about anything that we've missed out that you'd like to touch upon, or about any resources that you think parents and families should know about, that would be great. Dr. Gruber, would you like to start?
Sure. I think that, the COVID-19 pandemic is really a reality check for the field of mental health. We're seeing that the acute and now chronic stress that everyone's enduring. Today, we've talked about children, we've talked about adolescents, young adults, as well as their parents, and sort of how everyone in the community is sort of grappling with this stress. It's bringing to light a lot of pre-existing vulnerabilities people may have had, as well as really sparking the onset of new vulnerabilities. Everyone's going through this, and it's no wonder we're seeing these increased rates of depression and anxiety and substance use among our college-aged adults. I think, however, that's why we should be inspired to make change in our field, right? To rethink and reinvent what is mental health and what does it look like? And in particular, how can we disseminate mental health to people who need it the most? So it's an opportunity and really a catalyst for change to reinventing, how we deliver mental health, thinking about ways to do it remotely, to do it in different circumstances, to really underscore the importance of peer-based support and interventions as well, that it doesn't always have to be an expert therapist or psychiatrist in the room dispensing sort of pearls of wisdom about mental health, that we can all kind of support each other, and that in many ways we can all get involved, right? We can all get involved in creating really a rally around discussing and normalizing mental health and illness during the pandemic, and also about thinking about it differently and approaching it as we move forward. So as much of a stressor as it is, it's also an opportunity for profound growth and change in our field.
Thank you, Dr. Gruber. Dr. Parris?
Sure. I'd like to talk a little bit about the population that I work with specifically, because I think we can learn some valuable lessons from them. So obviously we are living in an unprecedented and challenging time. And as a pediatric psychologist at St. Jude, I work with children who are dealing with catastrophic illness. And many of these children for years have had to do the things that our society is now being asked to do. So they have to wear masks. They have to socially distance. They can't go to school at times. And yet what we have seen through years of research and years of clinical work with these patients and families is that they can be quite resilient and they can be quite compliant with these restrictions and guidelines, particularly when the restrictions and guidelines are normalized and when people are surrounding them with support. So again, I just think there's so much we can learn from some of these children in particular that I work with. And my hope is that people can find meaning from the experiences that they're going through now, and that we can all heal and grow from this.
Thank you, Dr. Parris. Dr. Berkowitz?
Boy, I have a lot of thoughts. I don't know which ones are coherent, but I think there's I'll start with what I think is the positive from this experience, which is everybody will face tremendous stress in their life at one time or the other, or traumatic experiences. And I think what we haven't done a great job of, and we can do, is through the social emotional learning experience to build people's capacity to manage and cope with these stressors. Just as Dr. Parris was talking about with these children with severe chronic illnesses, often remarkably, in terms of their outlook on life and their ability to function. And I think it's really something that we haven't done as a society, and we really can do. And I'm hoping that we learn from the current situation about that. The other thing I want to say, I am a child and adolescent psychiatrist, but during the pandemic situation and the other events, My focus has really been on the child caring system and adults. We need the structure and stability for families and for children to thrive. And in what's happened, I think we've seen this, schools, not knowing whether to open, not open, giving different bits of information one week from the next, things like that. That just causes more confusion and stress. So the more we can help these systems that serve children get organized, understand, reach out in a compassionate way, I think we'll see better developmental outcomes for many of the children. But I really think these systems matter, and more so now than ever. And that's who I believe needs most help from us, are family systems, school systems, and other child serving systems.
Thank you, Dr. Berkowitz. I think we have a couple of minutes more if anyone would like to add anything. Any specific resources that you'd like to share with parents that can help them at this time?
Sure. I will mention that the institution where I work, St. Jude Children's Research Hospital, has a wealth of resources available to families in managing COVID. We have developed coloring books for children that explain the virus and explain other issues related to the pandemic. We have activity books for teens, and then just a host of other tips and resources for parents coping right now.
Thank you, Dr. Parris. Well, I think we're kind of at the end of time here. Thank you all so much again for your time and for sharing with us your expertise. During such an uncertain time, it was really great to have perspectives from experts in the field. I will take away a lot from this conversation, and I think so will everyone who tuned in. Thank you also to everyone who helped organize this session and to everyone who attended today. Yeah, bye.
Thank you so much.
Thank you.
Bye-bye.
Bye.